At present, the world has to encounter the problems of climate change, environmental degradation, disasters, and epidemics of emerging and re-emerging diseases, which are common health problems of many countries. For Thailand, the guidelines for responding to both groups of diseases affecting people's health have been developed, including the systems for disease surveillance, prevention, treatment, and control under the One Health concept. For example, working collaboratively in a multidisciplinary manner among officials in the human and animal health, as well as environmental sectors. Moreover, actions are ongoing regarding the development of capacity and preparedness of the management system, as well as personnel and knowledge management for efficiently preventing and controlling communicable or infectious diseases, according to the internationally recognized standards. Infectious disease control in Bangkok, a variety of urban communities. Bangkok, the capital of Thailand, is the center of political, economic, and social activities of the country. Urbanization has led to changes in all aspects, with a lot of problems, including those related to public health. This is the office of the Bangkok Metropolitan Administration, BMA, in which its Department of Health is located. The BMA's Health Department is in charge of promoting and supporting health programs, including health promotion, disease prevention and control, primary care, rehabilitation, and drug dependence prevention and treatment, consistent with those undertaken by the Ministry of Public Health. As the urban population has been rising within the same land space, disease prevention and control is one of the programs that are challenging. Dr. Wongwat Liulak, Director, Communicable Disease Control Division, Bangkok Metropolitan Administration, said that as Bangkok is a large city and the center of all modes of transportation, it is rather difficult to detect where and when a disease outbreak occurs. Such challenges are dynamic and hard to respond. During a disease outbreak, many units of the health department have to coordinate and integrate their disease surveillance activities with several other agencies through the BMA Epidemiology Center of the Communicable Disease Control Division. The center will collect outbreak information, undertake case investigation for analysis and determine ways of disease surveillance, prevention and control, and it has to coordinate with all other relevant agencies within and outside the BMA jurisdiction. Today, a meeting is being held to discuss ways to respond to dengue hemorrhagic fever and several other diseases that need to be continuously under the surveillance system. As BMA covers a population of nearly 10 million, the overcrowded living conditions might be related to the disease outbreak. Dr. Wongwat said, one of the major actions in disease control is warning of the outbreak. We need to know first what has happened and the risk, based on all the data or information regularly collected and analyzed. And then we can send a warning to all agencies concerned, such as BMA's public health centers and 71 surveillance and rapid response teams, SRRTs, to conduct case investigations and rapidly contain the outbreak. This is regarded as a major part of our efforts. Meanwhile, another major role related to supplies and equipment for disease prevention and control under the responsibility of this General Communicable Diseases Group is serving as a depot of various vaccines for distribution to public health centers and other relevant agencies.
จริงๆในโรคติดต่อเนี่ยค่ะในการเฝ้าระวังก็ทุก
Jantra Chuntanom, Chief, General Communicable Diseases Group, said, "Our group distributes the vaccines against almost all vaccine-preventable diseases for use by the public health centers to prevent the disease outbreak that might occur. Moreover, the vaccines are also used for immunizing certain people who will be traveling abroad. The quality of our vaccines is in accordance with the international standards and the requirements of the Ministry of Public Health on storage and transportation, and we have to coordinate with all relevant networks during the normal and outbreak situations in exchanging technical information and practice guidelines." The group also conducts research and development activities, distributes knowledge and technology, and sets standards and criteria for disease surveillance, prevention and control for BMA's public health centers, district offices, and schools. For the policy to the operational level, Public Health Center 64, Klong Samwa District, is representative of all other operating public health units scattered throughout Bangkok that provide healthcare for the people in 4 dimensions. For example, curative care, disease prevention and control, health promotion, and rehabilitation. Today, this center is giving vaccinations to children as per the established schedule for child immunization against various diseases.
กึ่งหนึ่งเป็นโรงพยาบาลชุมชนนะแต่ว่าไม่มี
Dr. Kietikun Silabut, Director, BMA Public Health Center 64, Klong Samwa, said, "Here we serve as a frontline healthcare setting, working like a semi-hospital and a semi-district health office. Regarding disease surveillance, prevention and control, we have a surveillance and rapid response team with supplies, equipment and personnel, as well as regular meetings, warnings for other agencies concerned, according to the established guidelines. Importantly, we have a good network of urban health volunteers that helps us with the disease surveillance and prevention efforts, especially at the community level." Today, field visits are being carried out by health officials from Public Health Center 64 to meet with health volunteers at the KC Community Health Center. At this place, the health volunteers get together to conduct a campaign against dengue hemorrhagic fever. These volunteers are community members who voluntarily help with local health activities. Among themselves, some volunteers are assigned to take on different tasks, such as campaigning, notifying and communicating with health officials and local residents. Benjapan Muang In, Chairperson, Urban Health Volunteers Club, Public Health Center 64, said, "At present, we help take care of local residents' health, covering communicable and non-communicable diseases, including influenza, avian flu, other zoonotic diseases, as well as diabetes and high blood pressure. During this period of time, we focus on dengue hemorrhagic fever, regularly conducting a campaign and inspection in the community every Friday. With our volunteer spirit, we do as we realize the importance of health and spare some time, taking turns working for the community. From policy to practice, basically, the BMA's health department's functions do not only cover the activities mentioned earlier, but there are many other subunits working collaboratively on disease surveillance, prevention, control, and medical treatment. A disease outbreak might be transmitted from animals, food, and the environment. All concerned have to take part in public education and campaigns on healthcare during both normal and outbreak situations in context of Thailand's capital city.